all for digital health and data and these tools and technology driving people's opportunity to improve their health, I have to say that I feel like I'm a bit in the twilight zone because at the same time we're here talking about this issue, my colleagues on the other side just passed a bill that would effectively take away health care for 16 million Americans. People who are on the brink of losing their health care coverage, when premiums soar, when millions face crushing out-of-pocket costs, all because we want to give tax breaks to billionaires. The truth is, it doesn't matter how much cutting edge our healthcare technologies become if working families cannot afford to access them. We're very privileged here. We can talk about our devices, I've got mine, but that's not the majority of the folks that I'm here to represent, and I've got to make sure that their voices are heard as well. In fact, Ms. Corlett, you put it best in your testimony when you said that today's healthcare policy hearing is, quote, akin to Marie Antoinette telling the people of France to eat cake. This hearing feels like a distraction, an attempt to shift focus away from the devastating impact of the big, beautiful bill that's making its way through the Senate, which guts the healthcare system to fund tax cuts for billionaires. According to the Congressional Budget Office, if this bill is enacted as currently written, 16 million people will lose their health care insurance. This is in part because of the Medicaid cuts, the failure to extend the enhanced premium tax credits, and other attacks to the affordable care marketplace. The Urban Institute found that the One Big Beautiful Bill will slash provider revenues by over $1 trillion in the next decade. In Nevada, total healthcare spending would drop by $4.4 billion alone. And as revenues drop, the cost of uncompensated care will explode, upwards of $283 billion nationwide, including $2.5 billion in Nevada. Last week, I hosted a roundtable with healthcare leaders from across my district to discuss these cuts and the impact that they would have on my constituents. Mr. Craig McCoy, the Chief Executive Officer of Centennial Hills Hospital, made a powerful point when he said that the biggest misconception of the Big Beautiful Bill is that people with private insurance think that it won't affect them. But the truth is, these cuts hurt them too. Cuts to Medicaid and the Affordable Care Act will increase uncompensated care, strain providers, and ultimately raise costs for everyone. The bottom line, hospitals will close in rural Nevada and rural America as well as in cities. Providers will shut down. Services will be scaled back. I have a rural community in Pahrump that does not have a birthing center and limited OBGYN services. So, Ms. Corlett, in your written testimony, you outlined the various impacts of the One Big Beautiful Bill on healthcare access and affordability. Can you outline for those who are listening the impact of the various healthcare cuts to the healthcare system at large, and what changes should patients expect?
Yeah, thank you for the question. And I think we've talked a fair amount about the numbers of people who are going to lose health insurance under this bill, but I want to thank you for also talking about what it will mean for healthcare providers and for the broader population that they serve. This bill reduces provider revenue by $1.03 trillion over the 10-year budget window. 40% of that decline is attributable to hospitals and 11% to physician services. Providers will also face a $278 billion increase in uncompensated care costs, and that doesn't even account for the Medicare sequestration that we talked about. When providers have a big increase in uncompensated care costs, they have to look for other ways to raise revenue. They're going to look to their commercially insured population. These are people with employer-sponsored insurance and other forms of commercial insurance. And they are going to demand higher reimbursement rates when they can, or they will consolidate, or they will close, or they will shut down service lines. Those are really the options. So it's higher costs for those of us with employer-sponsored insurance, and it means that particularly in rural and underserved areas, you're going to see reduced access to care.
Yeah. Mr. Kustoff, you're recognized.
Thank you, Mr. Chairman. Thank you for holding today's hearing, and thank you to the witnesses. Mr. Zagowski, close enough, fair enough?
Close enough.
First of all, thank you for your testimony.